Hi everyone, a very good morning to all of you. And I'm Dr. Sumer. With me, I have Dr. Deepthi. We are in the morning transform session every day at 10 a.m. on the DAMS app as well as on the DAMS Daily YouTube channel. It is always a pleasure to meet you all in the morning. So give me a thumbs up if you're able to hear us and see us.
Yes, absolutely. A very good morning to all the dear students, and it's a pleasure to be back with all of you.
And I'll today give you some insight on what I'm going to talk about, and I think that should be a way to analyze and understand how to study as well. Now, what we have seen is in any exam, there is a pyramidal structure. There are a lot of questions which are usual questions in the paper, which are like based on your PYQs and PYTs, which you need to master to qualify. But then there are some questions which are slightly tougher, which are slightly more indirect. You can solve it by elimination, but they are slightly more indirect. And on the
Yes,
top of the pyramid, there are discriminatory questions. These are the questions which only a student who has understood the art of medicine and understood the entire idea should be able to solve. This is called as pyramid. Now, to get a top rank, you need to get the all three of them working for you. You can't be doing only the top of the pyramid right. You need to get the basics and the common things right, then the mediocre, and then the top ones. So what
absolutely.
I'm
I
going to
think
tell
what
you
we
today,
will do, Dr. Samir,
I
is
just add a line here and I asked Rodip to add on to it because what I wanted to tell you today is there is a top of the pyramid set of questions which are integrated, which are multi-subject. Which are the ones which will make a difference in a rank 100 and rank 1? Rodip, your take on it.
absolutely yes. I think ये बहुत important बात है, which all of us need to understand. We've been saying it in different ways over last few sessions. See, majority of your paper, which is what I said yesterday as well, 50 to 60% of your paper is going to be direct, right? So from the previous year topics. And here, all you need to understand is that anyone, if you have to do well in the exam, you need to essentially master the questions which are directly coming from your topics. And that is why I said that DVT is something which is very essential because these things you need to get into reflexes so that you're not thinking a lot or doing an overthinking. Okay? Then, as I said yesterday, the middle zone, say around 20% or 25% of the paper, is going to be still from PYTs but indirect, which is what Dr. Sumer was saying. ठीक है, so इसका मतलब ये है कि उसमें they will be asking you common topics, but either they would make the options very close, right, or they will go into more depth of that topic. ठीक है, and then 5 to 10% of questions are going to be in the discriminatory part, which means there you will have to use your basic knowledge to maybe exclude options. Even sometimes additional knowledge helps, but that percentage of questions is less. So for anyone to do well, the order has to be the same. We cannot afford to do bad in the common things, direct things, no silly mistakes in that 60% of the paper. Okay? People who get out of the cluster zone, अब मेरी बात सुनो, जो lower most base है, that gets you into the cluster zone. ठीक है? Now, if you have to get out of the cluster zone, you have to hit the next 20-25%, which are indirect, right? And if you want to be in the top ranks, yes, we would need to approach the discriminatory ones as well. Okay?
Now, yesterday on Sunday, actually, I was talking to a lot of students, and a lot of them had a query, ki, boss, how do we integrate? All the teachers talk about integration, but how do we integrate and how do we learn to integrate while studying? So, my first answer to you is whenever you are studying your basic sciences like anatomy or pathology or microbiology or physiology, at that time you need to ask why. You need to ask the word, why is this clinically important? Even if you're a first year MBBS, second year MBBS, third year MBBS intern, whenever you're starting and you're reading your basic sciences, you need to start asking why. Now, suppose they tell you the anatomy of, say, this is thalamus. So you need to ask why. If they say this is blood supply of this, midbrain is this. So you need to think why. What will happen if there is a stroke? What will happen? You start thinking why and you start extrapolating. It will be tough to do if you are a beginning to study. It will not be easy to do, but you ask the why. And second thing is, at that level, you trust your mentors to help you see the other side, because maybe you're a medical student, you don't know the clinics so far. You need to trust your teachers and mentors, and that is why, at DAMS we, in our back to basics, we put a separate folder where two teachers are teaching a topic. It is India's first integrated approach. It is a full folder based on what NMC has, prescribed. What should be integrated learning? All the topics are there with two teacher perspective in the app in the integrated rounds. You might not have seen that. I know you might not have seen that because we all keep following like sheep what others are doing, what others. You understand that two teacher perspective is very important. Now, second is when you come back to the clinics, like suppose you're reading surgery, you're reading obs and gynae, or you're reading, say, anything in your clinical field. Now you look back and connect the dots. Now you try to look back, where was this topic in the basic sciences? Why, if like when I was teaching brain anatomy on a CT scan recently on a classroom, a lot of students came and said, sir, अब जाके लग रहा है कि anatomy पढ़नी चाहिए थी. And I told them, boss, in the week going forward, if you have the time and you start early with DAM, so you have the luxury, can you go back and read your anatomy, neuroanatomy from your back to basics video and see the cadaveric images? Try to correlate with what I have taught in the cross section. So when you are in the clinical side, you look back and connect the dots. When you are in the basic science, you try to look forward by asking why. If you can develop this approach, you will start answering the top level questions better than others.
And
I'll get you to add on, then I have one more interesting thing to tell you.
okay. Also, I always tell this in my classes. So if you've been with me, मैं हमेशा जब भी कुछ पढ़ाती हूँ मैं बोलती हूँ if this thing comes for the first time in the exam, it will come as a direct MCQ. For example, they've been repeatedly asking what is the most common site of tubal ligation. इतनी बार ये PYQ आ चुका है. The answer is isthmus. Then I always say if they have to ask the same thing again, they will actually ask the why, right? So which was a recent exam question. Why is isthmus the most common site? So you have to understand it's not just to integrate, it will also help you in predicting the new questions in the upcoming exams. Do you understand this? And that's exactly what we do when we teach live on the app or even in our back to basic videos, right? So we will always start from scratch no matter what year you are in, right? Even if I have to teach obs and gynae, I would start from anatomy. And that's the art we all have to learn. Even for your exams, whether it is professional, whether it is entrance, that has to be the way forward to be able to apply the information that you know. Yes?
And finally, this art of integration, once you start doing it in your studies, will help you to make an educated guess. Like suppose you have a say radiology question in the exam. You may not know radiology, but you know little bit of pathology, and based on your radiology knowledge, you might have ruled out two choices. You are in the final two choices at 50-50 probability. So at that time, instead of using the subject question, you start looking at other subjects. मतलब अभी रेडियोलॉजी को ना यूज करके या मेडिसिन को ना यूज करके हम सोचते हैं can I solve this on the basis of microbiology, can I solve this on the basis of pathology, can I solve it on the basis of my basic science knowledge, and you tilt the 50-50 probability to 60-40, 65-35 and make an educated guess. So what I wanted to emphasize today in today's video is that top rankers are not only getting the usual questions right, they are not only getting the repeat questions right, they are also getting the top of the pyramid questions also right, which are mostly integrated. They cannot be solved only by one subject knowledge. You can solve them by when you know the concept. And ultimately, this will make you a better doctor also, because as a doctor, you will not have a surgery patient or a gynae patient or medicine patient. You will have a single patient. You will have a single patient. So if me and Dr. Deepthi always we talk about also that suppose somebody is operating on a gynecological patient, but the patient also has a liver, also has a kidney. Something can go wrong if you don't know it, you are stuck. So that is where integration helps you in healthcare when you are managing patients. You go up the ladder. You start your own your own hospital. I'm sure you are all feeling happy कि सर अपना खुद का हॉस्पिटल बनाएंगे. तब भी तो सारी स्पेशलिटी चाहिए होंगी, अकेला थोड़ी कर लेगा. You understand? Even if you're a surgeon, you need an anesthetist, you need a radiologist, सब चाहिए. वैसे ही सोचना शुरू करेंगे, your ranks will start flying over the top. लोगों को समझ ही नहीं आएगा तो टॉप क्यों करने लगे. If you are a third year or fourth year listening to me right now, go to your back to basics. Look at a folder called as integrated rounds. Beautifully done. Over the years in DAMS, ever since NMC has come into play, we made a separate folder on integrated topics to teacher perspective. Beautifully done. Start looking at them instead of watching Netflix on the next episode, next episode, next episode. Do this one time, you will enjoy it.
Okay, so now quickly for our other bachas who are going to give the exam now. The purpose of today's session was that you understand the same approach you need for your coming exam, and DBT is going to solve all the purpose, which means I want everyone to revise DBT in these last few days because it will have the direct answers. It will also have answers to the indirect questions, and you should be able to integrate when you are doing all 19 subjects rapidly close to the exam. So it makes it very doable with a very good hit rate for both direct and indirect questions. Okay. For indirect questions, everyone needs to use the guess it technique. If you haven't seen mine and Dr. Sumay's session on Transform called as Making an Educated Guess, please see it. It will change your life. You will understand how you can even answer questions which you felt are out of your league, okay, or you were probably going to leave completely. So please do that. And as far as the strategy forward is concerned, you've been asking me, I've been replying it. Okay, DVT is a must do. Your wrong diary is a must do. Okay, and I would say if you have given our CBTs and the yesterday's mock, please go through your mistakes once again. The CBTs and mocks are from topics which have highest probability. They will have all forms of questions, direct, indirect, and some above the league. So they give you the right mixture of what you need. Okay, so analyze your mistakes. Also, on everybody's request, although I feel it is, not the right way, but yes, I've opened the mock again for reviewing, but अभी बहुत सारे और बच्चे भी वो test देंगे, so don't worry about ranks now. Focus on your number of correct questions now. Okay, and we will be waiting for the marathon sessions for all of you. We will try and make the marathon super high yielding. So how many of you attended the live discussion of the mock yesterday? Did you find it useful? Yes. Was it effective for you to revise?
I think it was brilliant. I saw the students and the teachers doing it.
Yeah.
It was brilliantly executed. And the entire idea was to give the students a feel of how it feels when a teacher explains the MCQs. And that is what you get in every GT in DAMS, you get it in every class test, every SWT. And our goal is to give you the momentum. Momentum aaya na beta? That is the idea. Push kare, push. And we will help you with the momentum, with the marathon also. बहुत जल्दी NEET PG marathon भी आने वाला है.
Absolutely, yes. So there is another GT which is going to come over the weekend for you. So like a test practice, but don't worry too much about your number of corrects. Just get into the rhythm. Just get into the form. कि MCQ देखेंगे, घबराएंगे नहीं, options को analyze करेंगे, guess it use करेंगे. Play around with that GT, okay, to get the confidence that you need. Please don't focus on as I said, don't focus on your number of correct or your scores or your marks. Just take it as a test, okay, for getting into form.
So I'm happy that you are all excited for the marathon, and I'm happy that many of you appeared for the mock, and I'm sure some of you missed out, but you can now go and see it on the app and give the mock now. We have opened it again for on request of many students. Entire team was bombarded, so we opened it again. And also, I think what we have learned in the last 25 odd years is ज्यादातर बच्चे मॉक टेस्ट डेट खत्म होने के बाद देने की मन करता है. आई डोंट नो व्हाई
Yes,
इट हैपेंस, लेकिन
why?
ज्यादातर बच्चों का मन पेपर देने का डेट खत्म होने के बाद करता है. सीबीटी रजिस्टर करने का मन सीबीटी होने के बाद करता है.
They
सीबीटी सो डोंट बी
probably
दैट
they
गाय,
think that even
टेक
one more
इनिशिएटिव.
will make them prepare better for it. है ना? I think it's like that.
And so we are happy to be able to connect to you every day in the morning and give you some pep talk, give you some ideas. Today, my idea is whenever you're reading basic sciences, Start asking why. Whenever you're reading clinical sciences, start asking, look back, where did I read about this concept in my basic sciences? You will feel a much better doctor, and even the joy of learning itself will give you more joy rather than, we don't हम हमेशा कहीं पहुंच के खुश नहीं होते, समझ आने से भी खुश होते हैं. So that is my suggestion, and also use this integration in MCQs. Sometimes the questions of psychiatry can be solved through your pharmacology knowledge and vice versa. Sometimes you solve medicine only by knowing pathology. It happens with toppers. You can be the topper if you start using this approach of integration and making educated guesses.
Okay, I'll just take up few last queries, Dr. Samir, and then we can wind off. एक बच्ची बार बार पूछ रही है कि if I start studying now, can I crack November INICT? Absolutely yes. So, in the app TND, now you will get NEET PG TND as well as INICT TND. Anyone who is going to target the November exam for any set, TND, INI TND is an excellent resource. It gives you time to study, to apply, focuses on topics that INI CT asks, right? So app TND is what will give you both the NEET PG TND as well as the any set now. We have given it as a combination. And yes, just to let everyone know, the prices are going to revise after NEET PG. So if you really want to take up the TND, app TND now, it's a good time. Okay. Yes,
And
then.
okay, Dorothy, please continue. I think.
Okay, no, I was just trying to see there were a couple of other queries which I wanted to answer, but I've lost them now, so it's okay. Yes, zone wise. कुछ बच्चे बोल रहे हैं zone wise क्या करना है आप वो बता दो. बेटा आप कोई zone wise नहीं है. Now it's the last few days before the exam. Everyone needs to revise their DVT. Everyone needs to revise their mistakes, and everyone needs to practice some MCQs every day. What would be good for everyone is 2 hours या 2.5 hours के लिए DVT रिवाइज करो, then give yourself a 30-minute window or a 20-minute window for MCQs. फिर दोबारा से DVT रिवाइज करो, then give yourself a window for MCQs, right? So ऐसे करेंगे and tests करेंगे. You have GTs, you have lots of mocks in your test series, so do that, okay?
And before we go for the day, I have some announcements to make. Number one announcement is for all of you, very important. We will be doing NEET PG Marathon on 29th and 30th on DAM's YouTube channel starting at 11 a.m. Please mark the date. The links of the videos are already there on the YouTube channel. Please click on notify. Many students they come after the marathon and say कि सर बाद में देखा नहीं जा रहा, live आसानी से हो जाता है. If you try to see it later on, it becomes a humongous task. Please watch it live. Second announcement that I have is we have announced the opening of the prelim round of the DAMS Grey Matter. If you're a third year, final year intern, this is the quiz to participate. The prelim round is on the DAMS app in the event section. You can register, and on prelim will happen on 17th August, and we will take from anybody can participate individually. अकेले अकेले participate करोगे, team हम बनाएंगे. आपने नहीं team बनानी, वो हम बनाएंगे. Based on the winners, we'll make a team, and we will be calling the winning teams to Delhi, and we'll do a mega finale in the Delhi. And many times the AIMS toppers, actually almost all the times, many times the NEET PG toppers are Grey Matter winners. And final, we are going to do something big today at 5 p.m. We are going to do something big at 5 p.m. Any guesses? Any
Oh,
guesses?
that's
What will
a
we do on
mystery
5
box.
p.m. today?
So what is there in this mystery box? Is it your NEET PG rank? What is it there in the mystery box?
So today 5 p.m. you can see a black box with the alpha written on it. This box will be opened today at 5 p.m. on YouTube channel. Be there live to see it. I wish you all the best, and just keep reminding yourself, at the end of the day, human body is one. We read it in compartments for sake of making it easy for the doctors. असली में तो सब मिला हुआ है ना, ऐसा नहीं है ब्रेन अलग है, हार्ट अलग है या गट अलग है. नाउ there's so much research ongoing on what muscles contribute to metabolism or how gut helps us in brain health and so forth. You need to start integrating. That will be the key. That will be the key, beta. Wish you all the best. Look forward to meeting you on the other side after your exams as top colleagues. Look forward to seeing you as top doctors and consultants, and have a productive day today.
Take care, everyone. Revise, revise, revise. DVT, give MCQs, give various tests that are there. See your mistakes and review them. Take care, everyone. Have a wonderful day ahead. Bye.